President, I rise today. I'm sorry, Mr. President, are we in a quorum? We're not in a quorum.
We are not.
Okay, so I'm going to proceed. Mr. President, I rise today because I think it is painfully clear that we need to do something to address the growing healthcare crisis in this country. Let me be clear at the outset, what I'm going to talk about now is a CRA that the clerk just reported. It is not directly related, it is not the tax credit issue that has been a subject of an enormous amount of other debate and frankly, action in the House, but a CRA that will be voted on later today that will overturn a rule that this administration has put forward, the Trump administration put forward, that will result in 1.8 million Americans being thrown off their health insurance. Now, this is beyond the tax credit issue, it's beyond the Medicaid changes. This is a rule that the administration set forward last year that adds enormous amounts of regulatory burden for any American who chooses to access the so-called Obamacare marketplace. And the truth is, this administration's attack on the marketplace, Obamacare, the Affordable Care Act, didn't start with this rule. As we all know in this chamber, this is just another step in a now close to 15-year crusade by many of my Republican colleagues to undermine the ACA, which at the end of the day is just going to, as we've seen already, is going to increase healthcare costs for everybody. We know at the end of last year, as the expiration of the ACA enhanced premium tax credits approached, Democrats in Congress worked hard to try to extend them. We put forward a strong compromise proposal to extend the credits and keep health insurance affordable for the close to 24 million Americans who access their health care through the marketplace. Unfortunately, time and again, Republicans voted against it, ensuring that when the clock struck midnight on January 1, millions of Americans were priced out of that coverage. Families across the country have now been hit with premium increases of $800, $900, and even over $1,000 just per month. We talk about somebody in my state, in Virginia, Kathleen, a mother of two and a small business owner living in Newport News, saw her premium for her family of four increase from $544 a month to over $1,500 a month. That's a yearly increase of about $11,500 a year, a price tag that her family just can't afford. She told me she came up to the Hill before New Year's hit that she hoped and prayed for a solution. I think, frankly, I wish all of my Republican colleagues who helped block that solution could have explained to her why blocking that solution, which we offered as a straightforward extension of the ACA premium tax credits, why they blocked that, because Kathleen and so many other families desperately needed it. I will have to say I got to give some rare congratulations to at least 17 members of the House, Republican members of the House, which had actually taken action recently to address this crisis. 17 House Republicans finally said enough and voted with Democrats in the House to extend the credits, which will again lower the cost for millions. I hope that we can get a similar type of compromise through in the Senate. I know there are colleagues on both sides of the aisle working hard on that issue right now. And while the credits have taken up most of the space around the debate, what I rise today on the CRA that will be voted on this afternoon will provide even more immediate solution to at least take away another barrier to healthcare accessibility and affordability. I'm asking my colleagues, and I'll be joined by other colleagues to talk about this over the next hour or so, I'm asking my colleagues to join me in disapproving of a harmful rule that the Trump administration finalized last year that was set to kick in at the end of 2025. And as I mentioned, that would take off about 1.8 million to 2 million people off their health care because of the enormous administrative burdens that are put in place by this administrative rule to try to get access to the marketplace. This is at least a chance today, not at some future date, to come together to do the bare minimum and address at least a small part of the emergency straining our healthcare system. Now, I will acknowledge that because this administrative burden was so burdensome, the courts have paused its enactment, but at any moment, that pause could be taken away. So let's just use the CR, which has been used by both sides of the aisle repeatedly, to get rid of this additional burden. Because simply put, this harmful Trump rule makes it harder to enroll in a marketplace plan, harder to stay on a marketplace plan, and harder and more expensive for states to run a marketplace. The rule requires increased paperwork for families, reduces open and special enrollment periods, and allows insurers to push more health care costs on Americans by allowing plans to cover less care. That also adds a ton more paperwork and burdens on the marketplaces all across the country. And again, according to the Trump administration's own document, these added barriers and higher premiums will lose to that estimate of at least 1.8 million people losing coverage. If this rule, which is again scheduled to go into effect, but has only not gone into effect in 2026 because of a current pause by the courts. But I think we ought to avoid this cliff and just act today as the Senate and say, let's not have this rule take effect. I think most of us would agree that 2025 was not a great year for health care in this country. Medicaid cuts, which are going to be enormous, which frankly were not scheduled to kick in until after the 2026 elections, interestingly enough, although I can tell you we've already seen rural health care clinics closed in Virginia because of that expectation. My colleagues' refusal to extend the enhanced premium tax credits are all weighing down on our health care system. And we're seeing, particularly rural hospitals and rural health care centers, really bear the brunt of this. The truth is the Trump administration and congressional Republicans have jammed through health care policies that combine the rule, the tax premiums, minimum looks like about 15 million Americans will get kicked off their health insurance. So let's go back. My Republican colleagues and the president won in 2024 because they're going to lower costs. Well, we can actually take action on lowering costs today. So let's join together, use the CRA tool, and end this policy. All you have to do is vote for the Congressional Review Act resolution, making sure, again, the number, not my number, the Trump administration's number, meaning that 1.8 million Americans will actually get to keep their health care. All you have to do is vote for this CRA resolution so that folks don't have to deal with enormously burdensome paperwork and the higher costs that result. Now, I think we can get this done. We've seen my Republican colleagues stand up to the president on the Epstein files, on war powers, and just in the last day or so, the attack on the independence of the Federal Reserve. Let's have that pushback extend now to healthcare costs. Let's help keep millions keep their health care today, and then work together towards a long-term sustainable plan to keep health care costs stable for the next decade. Before I yield the floor, I want to also acknowledge this is something that a lot of us have been working on. Senator Klobuchar, who does such a great job on so many issues, Senator Wyden, who's our leader on the Finance Committee. They and others will come today to speak on this issue as well. I hope my colleagues are listening, and I hope they will actually acknowledge we got to bring healthcare costs down today. This isn't a full solution, but at least it's an action that we can take today. So with that, Mr. President, I yield the floor.
Thank you, Mr. President, and I want to thank Senator Warner for his tremendous leadership on this important issue that is just really tormenting so many Americans right now, as well as Senator Wyden. This involves tens of millions of Americans who are facing a healthcare crisis. Their premiums are doubling or tripling, and it is completely in our hands to do something about it. Open enrollment is ending in 2 days. Americans across the country are looking at their budgets and facing this difficult choice of whether to pay double or triple for coverage or go uninsured. And why are tens of millions of Americans facing this reality? Well, because congressional Republicans failed to act, to come to the table, to negotiate an extension of the Enhanced Affordable Care Act tax credits before the end of last year. Last Thursday, the House passed legislation to extend these health care tax credits for 3 years. 17 Republicans joined Democrats. You think about it, they could have done that months ago. Months ago. We were willing to negotiate with them 3 years, 2 years, 1 year at the time. They wouldn't do anything. And now they've realized, I guess they didn't understand what was happening to their constituents when 20-some% of farmers and ranchers are on these kinds of policies and 75% of them are in red states. This legislation that Senator Warner and Wyden have proposed is simple and reasonable. We're simply saying let's make sure the same tax credits that make care more accessible for tens of millions of Americans yesterday and last year and the year before that continue to be there for families this year. Americans are looking for us to act, and the time to act is now. I've heard from people across my state in what is a very, very difficult time right now in the state of Minnesota, with the arrival of ICE on our streets, with people terrified, with the chaos that has ensued. We are still hearing from people about health care all the time. Nikki from Waseca wrote to me that the health care premium for her and her husband almost tripled from $862 a month to $2,344, which over the course of the year is more than her annual salary. She called the increase insufferable. Nadine from Sartell, a 53-year-old single mom, shared that she has a master's degree in social work but lives nearly paycheck to paycheck now because her housing and utility costs eat up over half of her monthly income. And unless Congress renews the health care tax credits, she's not going to be able to purchase health care. Of course, there's only 2 days left. And here's the kicker. Just 4 months ago, she was diagnosed with breast cancer. She's already used up nearly all she has in savings for the copays and coinsurance to get a diagnosis and receive treatment. Another constituent, a school bus driver named David, saw his premiums double. He's now spending 12% of his total pre-tax income on health insurance. David wrote that it's difficult and frustrating to see life crumble before your eyes, just trying to get ahead and just to find setbacks waiting for you. I would like Congress to actually sit in real life people's shoes for just a while to see how it feels. I hope we can get something changed. That is a bus driver in Minnesota begging our colleagues on the other side of the aisle to stand and sit in his shoes. Because if Congress can't fix this, David shared with me that even though he works full-time, he will have to give up his health insurance entirely. The rules that Senator Warner and Senator Wyden and others of us have suggested do away with the caps that limit how much of their income people like David must spend on health insurance. And so as we work to extend the health care tax credits, it's critical that we stop the administration from further undermining the Affordable Care Act and raising costs. And this just isn't happening in my state, as I know 3/4 of the people who get their health coverage on this ACA marketplace live in states that President Trump won. We know the stakes, and we must come together to solve this affordability crisis. And I will note that the amount of money given to Argentina was approximately the same amount it would take to fix this for 1 year. There's a lot more work to be done to lower health care costs. Medicare price drug negotiations that I have led for years and making sure that's really happening under this administration, reforming prior authorization, making improvements, public option, we go on and on and on. But right now, We have one crisis that is hitting so many Americans, and we have a way to fix it. So I urge my Republican colleagues to join us to stop Americans' health care premiums from skyrocketing and simply bring to the Senate floor and pass the bipartisan House-passed bill to extend the health care tax credits that Americans rely on, and of course, to vote for SJ Resolution 84, which is in front of us today, and we thank Senator Warner and Wyden for leading the effort. Thank you, Mr. President. I yield the floor.
President,
Senator Morgan.
before she leaves the floor, I just want to say that the senator from Minnesota has been relentless in terms of standing up for folks who are just trying to get a fair shake on their premiums. I've been doing this since my days with the Gray Panthers, and I know what it means to be persistent. That defines Senator Klobuchar, and I thank her. I'm pleased to be working with Senator Warner and Senator Ossoff. I see Senator Kaine here, because all of us want to make sure we lower health care costs for American families. Today, the Senate's going to vote to repeal a host of damaging policies that Donald Trump, Robert Kennedy, and Dr. Oz have unleashed on Americans who are unsuspecting. People who are just trying to get by in tough times are going to get hammered. And from the day Donald Trump was sworn in, this administration made attacking Americans' health care their top priority. Last summer, Republicans in Congress rammed through a massive bill to give tax breaks to billionaires and giant corporations while making the largest health care cuts in American history. At the same time, the Trump administration used the Byzantine federal rulemaking process to double down on these efforts by finalizing the rule that all of us on this side of the aisle are working to repeal today. The harmful changes made by the Trump administration come down to one proposition. It's okay to have more red tape, and it's just fine to increase health care costs. That's the exact opposite of our agenda, which is to focus on affordability and making the American health care system simpler. I'm going to just tick through a couple of the worst examples to illustrate why these rules need to be junked. First, the Trump rules will increase what American families have to pay out of pocket each year by nearly $1,000. So the question becomes, Mr. President, what's the purpose behind that change other than to take money from Americans who are already struggling? The rule adds new fees, such as the new re-enrollment fee that applies to low-income workers. To be clear, that means if you want to keep your health insurance, you got to pay a fee to the government just for the right to keep what you've got. Even by Washington, D.C. standards, I say to my friend from Montana, that just defies common sense. They also create mandatory minimum premiums that are going to cause millions to lose their coverage. Now, Republicans say that these fees are aimed at reducing fraud. There's just no evidence to back it up. My view has been, ever since my days with the Gray Panthers, and my friend from Virginia knows about this, I say any fraud is too much. But the numbers are clear. The vast majority of fraud in health care is conducted by shady insurance brokers who are looking to make a fast buck through commissions from phony enrollments, not working Americans looking to buy health care. So I've introduced legislation to create tough criminal penalties for these insurance brokers. So make no mistake about it, Senator Kaine, there's something we ought to be doing to root out fraud. Let's go after these insurance brokers with tough criminal penalties. I've been talking to Republicans to ask them to join as co-sponsors, and they haven't been willing really to give us the time of day. Instead of going after fraud where it exists, Donald Trump and Republicans create barriers that are going to trip up Americans trying to navigate a health care system that's just too complicated. Beyond fees and higher premiums, the Trump rule also adds new verification checks and enrollment rules that amount to an enormous heap of red tape. These red tape measures, according to authorities who've analyzed it, is going to create 15 million hours of paperwork. 1.8 million people are going to lose their coverage as they try to navigate this never land of a maze of health care rules. These types of changes are right out of the playbook of big insurance because they create barriers and bureaucratic hurdles so they keep more of your money while denying working families basic health care. It's no secret that Americans have had a bellyful of a healthcare system that gets in their way at every turn. It's time for Republicans to do the right thing and join with Democrats to lower Americans' healthcare costs instead of creating new cost barriers and red tape restrictions. They can help those families by voting with us today. I urge my colleagues to support Senator Warner, Senator Ossoff, Senator Klobuchar, Senator Kaine. We're all here for one purpose: less bureaucracy, less red tape, lowering premiums for families. I yield the floor.
Mr. President.
Senator Virginia.
Mr. President, I'm glad to join my colleagues to talk about the upcoming vote on Senate Joint Resolution 84, the use of the Congressional Review Act to strike down a recent regulatory attack on the Affordable Care Act launched by the Trump administration. I think my colleagues have done a pretty good job of explaining what's at stake. Even the Trump administration's own experts at CMS, the Centers for Medicaid and Medicare Services, say that implementation of this rule could lead up to 1.8 million people to lose health insurance just this year, 2026. That would be devastating. On top of the premium increases that people have seen because the Affordable Care Act extended tax credits were not extended when tax cuts for the wealthiest were extended, this additional burden on this 1.8 million person population is unacceptable. And the vote we'll cast today gives us all an opportunity to sort of shore up the healthcare network for that nearly 2 million people. I wanted to focus in particular on a kind of person who is really going to be affected by the Trump rule if we do not affirmatively embrace this Congressional Review Act resolution, and that is self-employed entrepreneurs and gig workers. You know, one of the challenges about the American healthcare system before the Affordable Care Act was it was very, very difficult to buy health insurance if you were an individual entrepreneur, if you had a very small business. Without exchanges and the offering of policies on the exchanges with premium support for those who were lower middle income, you had a lot of people who were self-employed or entrepreneurs who couldn't buy insurance at all. And then you also had a huge group of people working with companies that had insurance that had this great American dream of an idea to start their own business, but they couldn't do it because if they were to leave their large employer to go off and follow their dream, they couldn't get health insurance. And one of the very salutary effects of the ACA through the creation of exchanges with premium support has been to enable people to pursue their dream and become innovators or entrepreneurs or gig workers and work in the way and in the flexible circumstance they choose. And Mr. President, I speak from experience because 2 of my 3 kids fit into this category. The rule that has been put in place by the Trump administration isn't going to make it particularly hard for large group plans to just re-up insurance, but it will make it very hard for those individuals that don't have an HR department fighting for them, that have to figure it out all on their own. It will make it very hard for them to negotiate the marketplace and buy insurance. And sometimes their income is up, and sometimes their income is down, and sometimes they want to enroll, and at other times they don't. It's precisely this kind of person that is going to be hit the hardest by the Trump rule, and why I'm so strongly in support of my colleagues' efforts to repeal it. You know, we often say, Mr. President, I'll conclude, that small businesses and startups are the backbones of the American economy. And they are. I grew up in a house with a dad who worked for a huge company, and it was his dream to start his own business. And he bought a little ironworking shop that at the time that he bought it had like 4 employees. And during the entire growing up period where I worked in my dad's shop, in a good year it would be 7 employees, and in a bad year it would be 4, plus my mom and my 2 brothers and me. So many American businesses are just like this. They're 1 or 2 employees. There's somebody who even has another gig, maybe as an artist, and they're moonlighting in some area where they can make just enough to afford to buy health insurance on the exchange if we don't crush them with high premiums and if we don't make the paperwork burdens so substantial. The CRA that my colleagues are offering will be directly responsive to the needs of this very, very important group of American innovators and entrepreneurs. And that's why I so strongly support it and urge my colleagues to do the same. Thank you.
Senator from Virginia. The clerk will call the roll.
Ms. Also Brooks.
Texas.
I'd ask unanimous consent that the quorum call be dispensed with.
Without objection.
Mr. President, I have two requests for committees to meet during today's session of the Senate. They've been approved by both the majority and minority leaders.
Duly noted.
Mr. President, my Republican colleagues and I have spent a great deal of time this Congress focused on securing justice for victims of crimes committed by illegal aliens. Unfortunately, during the last administration, the Biden administration was completely, what I would call willfully blind to the threat that posed by people coming unvetted across our borders. From Laken Riley to Kayla Hamilton to Jocelyn Nungare, the victims of illegal aliens are numerous, but they must not be forgotten. What makes these tragedies so heartbreaking is the knowledge that many of these victims could have lived but for the Biden administration's open border policies and its failure to act responsibly and enforce the law. These good Americans died at the hands of criminal aliens who should never have set foot in our country. But there's another category of illegal alien criminals who are perhaps not so widely known, largely because the mainstream media outlets refuse to report on the many heinous crimes committed by illegal aliens each year. These are individuals who've endangered Americans by drunk driving. Every 42 minutes, someone dies in a crash involving alcohol. And as we've seen in the news, many of these crashes have been caused by illegal aliens who jeopardize the safety of law-abiding Americans. They've killed or severely maimed U.S. citizens and other lawful residents, depriving families of their loved ones and causing untold human misery. Some of these aliens have driven with expired licenses, suspended licenses, or no license at all, and have shown complete disregard for the danger that they pose. Last January, 2 college students in Illinois named Katie Abraham and Chloe Polzin were killed in a hit-and-run crash involving an illegal alien who was drunk driving. Their killer, an illegal alien from Guatemala, was charged with leaving the scene of the crash, resulting in death, aggravated driving under the influence of alcohol, and reckless homicide. Last October, Secretary Noem highlighted more than 140 illegal alien truck drivers who were arrested in Northwest Indiana during Operation Midway Blitz. These aliens were found guilty of numerous crimes, including driving under the influence, drug trafficking, theft, burglary, assault, child abuse, domestic battery, prostitution, and fraud. More than 40 of them had been issued a commercial driver's license by states like California, Illinois, and New York. It's clear that these states are not conducting due diligence if they're issuing commercial driver's licenses to illegal aliens who threaten the safety of American citizens on their roads and highways. Of course, Texans have not been spared the harm committed by such aliens, as we saw in the case of Arturo Cruz Badillo. Cruz Badillo is a Mexican national who had seven DWI convictions, a conviction for battery, and was removed from the United States 3 separate times. But despite all of these criminal convictions and removal for illegal entry in the United States, he was once again found re-entering illegally last August, hiding in a commercial cargo trailer. He was sentenced to jail earlier this year for his crimes. On top of the revolving door of removals because of how different states treat DUI and DWI offenses, some aliens are convicted multiple times but never removed from the United States. As recently as last month, ICE arrested 118 illegal aliens in California, including pedophiles, burglars, domestic abusers, and serial drunk drivers. One of these offenders had 4 separate DUI convictions, including one that caused bodily injury. He was also convicted of driving with a suspended driver's license. Another was convicted of a DUI, a hit and run, and driving without a license. Yet another was convicted of causing injury to a child, a hit and run causing property damage, and 2 DUIs, driving under the influence. Finally, one of these criminals was convicted of DUI causing great bodily injury, a hit and run causing property damage, and a separate DUI. Mr. President, considering how devastating a car accident can be, even if there are no physical injuries, these accidents caused not only bodily injury, but property damage to a person's car, and it must either be repaired or replaced, often costing hundreds or even thousands of dollars. And in the case of a hit and run, the situation is even more difficult because the victim cannot get the insurance information, if it exists, from the driver at fault in order to have the damage paid for. For the 1 in 4 American households who live paycheck to paycheck, an unexpected car accident might mean having to choose between repairing their car or paying their rent. Of course, if the driver at fault is an illegal alien, it's more likely to be a hit and run because they don't want to be detained or deported. And even if they're caught, they're not likely to have insurance. As a father of 2 daughters, I believe the danger that illegal aliens pose to the safety of Americans is simply unacceptable. It ought to be unacceptable to all of us and not tolerated. For this reason, I'm introducing the Stop Illegal Aliens Drunk Driving Act to address this discrepancy in federal law, where these DUIs, repetitive driving under the influence, driving while intoxicated, are simply winked at or ignored. This bill would make DUI and DWI offenses that result in death or bodily injury an aggravated felony under the Immigration and Nationality Act. What that means, aggravated felons are subject to mandatory detention. They're also ineligible for most immigration benefits. Furthermore, this bill would ensure that any illegal alien removed from the United States as an aggravated felon due to a DUI or DWI who attempts to re-enter illegally is subject to a penalty of up to 20 years in prison. Americans deserve to be safe while driving on our roads. Parents should not have to worry when they give their 16-year-old the keys to the car and learn how to drive or just get their first driver's license. They shouldn't have to worry whether an illegal alien driving under the influence of alcohol is going to cause them bodily harm or kill them outright. We simply cannot continue the status quo of allowing aliens who entered our country illegally or were allowed by the Biden administration's open border policies and who decide to drive drunk or under the influence. We can't allow them to continue to endanger the American public in this way. For this reason, I hope all of my colleagues will join me and support the Stop Illegal Aliens Drunk Driving Act. Mr. President, I yield the floor, and I would note the absence of a quorum.
Clerk will call the roll.
Ms. Also Brooks.
Mr. President, I ask unanimous consent to vitiate the quorum call.
Without objection.
Mr. President, I ask unanimous consent to be able to complete my remarks before the scheduled recess.
Without objection.
Thank you. Well, I rise today because this president is poised to strip away health care from American families again. If Congress doesn't act to pass this measure, Americans will be forced to jump through more hoops just to get health insurance, and 1.8 million Americans will lose their coverage. This is just more of the same from Republicans and the president. Donald Trump and Republicans have spent over a decade trying to repeal the Affordable Care Act entirely, with no plan to replace it. When they haven't been able to repeal it wholesale, Republicans have looked for ways to attack and weaken the Affordable Care Act from the inside out. And this is just what the administration did with this rule. They are chipping away at the Affordable Care Act and taking away health care from Wisconsin families. While President Trump works out his concept of a plan, Republicans still have no real proposal on health care. Even if they could repeal the Affordable Care Act, they have nothing to protect the 24 million Americans who got coverage on healthcare.gov from being simply kicked off their insurance. Concepts of a plan simply are not good enough for the people that I represent. They deserve better. In fact, they need some breathing room and lower costs. Instead of meeting families where they are and lowering costs, Republicans are taking us in the wrong direction. At the start of this year, 22 million Americans saw their premiums go up in 2026 because Republicans refused to extend tax breaks to help families afford their health care. And behind every one of those 22 million Americans is a story. A family forced to make impossible choices about finances, their health, and their future. I'm talking about folks like Nancy and John from Park Falls, Wisconsin, whose premiums were set to increase by over $2,000 each month in 2026. Nancy wrote to me, "This is absolutely unaffordable. Literally, we cannot pay this. We would have to sell our home and our vehicles in order to just come up with the money to do that." Another constituent from Barron County, Wisconsin, wrote to me sharing that without the tax breaks, he would have to spend over 40%, get that, 40% of his income on health insurance alone just to ensure his wife could continue to get her treatment for her breast cancer. I also heard from Eric and his wife in Menominee, Wisconsin. They both retired from teaching after 30 years and are still not yet eligible for Medicare. He wrote to me that they were seriously considering going without any health insurance since paying close to $3,000 a month on a fixed income might just break the bank. Republicans ran out the clock on helping families like these, and the final window to get coverage for this year ends in just 2 days, on January 15th. How many Americans like Eric or Nancy are being forced to give up their health insurance this year? And how many more will consider selling their houses or their car just to make sure that they can afford sometimes life-saving care? And now, on top of this, the Trump administration is pushing a rule to kick even more families off of their health care. The rule we're talking about today would shorten the open enrollment periods and introduce much more red tape, locking eligible families out of getting their health insurance. We should be making it easier, not harder, for Americans to see a doctor. We should be making health care more affordable, not more expensive. Over the past year, I've talked to countless constituents who are sick and tired of Republicans' constant attacks on their health care. Instead of spending time coming up with new ways to kick Americans off Affordable Care Act plans, I urge my Republican colleagues to help us reverse this disastrous rule and actually start working with us to fix our broken health care system. I yield.
From Alabama.
Mr. President, I ask unanimous consent to complete my remarks prior to the scheduled recess.
Without objection.
Thank you, Mr. President. You know, for months, I've been raising the alarm over radical Islam infiltrating the greatest country on the face of the earth.